Good morning, Carol Johnson,
Good morning, Bob Ponce.
and welcome back. I know you were
Thank you so
traveling a
much.
little
It's
bit.
great to be back.
Yeah. So, we got a story to tell before we get into all the nitty gritty of our broadcast. We want to tell a little story about our former governor, Andrew Cuomo. He was still governor over the weekend, and as you may know, we had a little storm over the weekend, and as a result of that storm, he declared a state of emergency. And we can even take a look at what went out. So, because of the weather, hurricane or tropical storm Henry, he declared a state of emergency. And as you can see on this alert, it was declared that the Northeast Amtrak corridor was now closed. Now, I'll tell you an interesting story about my friend Carol Johnson. She always happens to be in the right place at the right time, sometimes for the wrong people. And if you say something, it better be true because she usually finds out during the course of the pandemic when they told us we were having testing in Harlem. She would roll up on the testing sites and find out either the site wasn't there, or they weren't doing testing, or the signs weren't there, or there'd been no notification to the community. And countless times when somebody said X, she showed up and said, no, that's not right, it's Y. So, what was interesting about this totally random event is that Carol Johnson happened to be on the Amtrak train when the alert went out saying that Amtrak was closed. So, Carol, please tell us the story.
Well, that was interesting. I was still, I believe, in D.C., and I got the alert from our colleague, Dr. Nesta. And I immediately spoke with the conductor. And he said, we've gotten no alerts. We're going into New York as far as we can see. So we're rolling along, and you know I'm staying in touch with the team. I have my NOAA radio, and I'm tracking the storm, and it appears to be out in Staten Island at this time. It says the Red Cross shelters would be opening, and other shelters to be on alert. And so now I'm in Jersey, so I'm assuming I'm speaking to the conductor. He came back and asked me if anything had changed. I said no. It's still saying that we're not going into New York. The corridor is closed. So now we're in Jersey. And so when we hit Trenton, I said, well, okay, there's a problem because if we can't come into the New York corridor, we would have to stop in Jersey. Well, we just kept rolling into New York. I arrived, no rain, nothing. Actually it was a beautiful evening. You know, and so getting off the train, we had a few words, and he said, "Well, that's really interesting. But if we had closed, you might have been the first one to know about it." I said, "Well, thankfully we didn't, because I'm ready to go home."
So, so Governor Cuomo threw an emergency and nobody came.
Well, I guess it was the last hurrah.
Mm-hmm.
you know.
Mm-hmm.
And once you got the president, I don't even remember last time that, the president outside of sometime during the pandemic when minus 45 called some kind of crazy state of emergency for something. Sure wasn't the insurrection, but he called some type of state of emergency. But,
Mm-hmm.
I just thought it was so strange when the president declared, and, we're in this place. And I'm like, but we're living in the midst of it. And there's no emergency here.
Mm-hmm.
I know it was bad in other areas, Long Island and Staten Island. But to say that the New York corridor was in that you know kind of shape that we would have to shut down, that that wasn't happening.
Yeah. So again, like we said, it's the last hurrah. I think he wanted to show himself to be, the executive, the the top man in charge, and I believe that he's going to try to make some sort of comeback, and he wanted to leave a lasting impression upon us that didn't involve his handsiness.
Well,
So,
I'm grateful to know that we check information, and that there was no panic here because once the conductor said we're going in, I said, okay, we're going in. That's all. I don't care what anybody says. We're going to New York. It's about 2 o'clock in the morning now, and so uh, I'm just grateful that because of the communication that we have, that I didn't panic. I didn't start yelling on the train. When New York is shutting down, we're not going to be able to go home. I just watched the alerts, and everything turned out fine.
hmm so the story of this whole pandemic has been the back and forth between Governor Cuomo, now ex-Governor Cuomo, and Mayor DeBlasio over who's really in charge here in the city, and there have been countless times where uh, Mayor de Blasio declared something to be true, and then Governor Cuomo would come behind him and say, no, we're not doing that. But that didn't happen this time because Governor de Blasio was under fire, and uh, Mayor de Blasio, that's when he came out with his executive order on uh, vaccination uh, passport mandate for basically all indoor establishments. So let's just kind of take a look at the order itself because we've all been talking about it, but what does it really say? So, whereas the COVID 19 pandemic has severely impacted New York City and its economy, blah, blah, blah. And whereas the state of emergency, blah, blah, blah. And it mentions the CDC and it mentions the variants and that vaccination is the most effective tool. Um, and it mentions the Delta variant. It mentions that indoor entertainment, recreation, dining, and fitness settings generally involves groups of unassociated people interacting for a substantial period of time. So it goes through all these things, and now here it gets to the point where it declares, and so it basically says that a covered entity, which is at any of those establishments mentioned, which is restaurants, gyms, coffee shops, any kind of entertainment venue, shall not permit a patron, full or part time, to enter the premises without displaying proof of vaccination and identification bearing the same identification information as the proof of vaccination. So you not only have to show the proof of vaccination, you also have to show ID. Um, the people who are exempted from this order are anyone entering an establishment for a quick and limited purpose. For example, using the restroom, placing or picking up an order, changing clothes in a locker room, or performing necessary repairs. Also, a non-resident performing artist not represented regularly employed by the covered entity while they are in the covered premises for the purposes of performing. So it's basically saying that if it's an entertainment facility and a musician or singer or somebody who is performing comes in, they have a waiver on this. The same thing is true for non-residential professional athletes. So if a team comes in and somebody on the team is not vaccinated, they are exempted. So other than that, everybody else, including regular employees of the establishment, will need to be vaccinated. Also requires the businesses to develop and keep a written record describing their protocols and to post a sign. And so there's a lot of burden on the businesses in terms of what needs to be done to comply with this. Now, let's talk about what's not in this order, which I think is a big, big mistake. Um, there's no connection between the actual uh, data in terms of where we are in the process, and there are no goals. So um, it just seems like it's an open-ended order with no connection to what are the current case rate, what's the current hospitalization rate, what's the current death rate. And the reason why I say this is that during the course of this whole pandemic, those things have always been put on the New York City website. When they talk about COVID data, there's always an area saying public health milestones, where they would look at the rates and say, when we get to this point, this is when we can open things back up. And that's how we proceeded. So for us to go into this scenario and not have any goals or not have any connection to the actual data that's going on, um, it just to me doesn't make sense. It leaves it very, very open ended. It begs a lot of questions. Um, and while we know that the Delta variant is right now the prevalent variant in the country, the fact is that the New York City vaccination and case rates are relatively low at this point in time. And so, what is the connection between the actual where we are and how long is this supposed to go on? So, those are questions that I think need to be answered.
I think it's a response to opening too early. A lot of people were saying, well, the country's got to open up, the city's got to open up.
Mm-hmm.
And, a lot of us felt that it was too early. We understood that the economy was suffering.
Mm-hmm.
But at that point, there were sightings of the variant.
Mm-hmm.
And I think it opened too quickly. I think people were allowed to gather in small spaces, in restaurants, and, the little outdoor hubs, restaurant hubs.
Mm-hmm.
People were just too close. And, on the other side, there was a lot of us that were saying, listen, we've been in this state for a while. Let's stay here and get a better grip on this thing before we start to open up so much. But
Mm-hmm.
now what we're seeing is the effects. And across the country, we're seeing the effects of opening just too soon. This thing um, with having to have the vaccine, proof of vaccine, as well as having ID. Well, this is something that was questioned when the vaccines first started because people were able to get blank vaccine cards online.
Mm-hmm.
And so there was a question then with that. How are these people allowed to get these cards and sell these cards? And I'm not going to call out the companies that they had them available, but these were some of the most reputable companies in the world.
Mm-hmm.
So now, I get it. I get it. But it's gotten so out of hand. Things have gotten so out of hand. And there is a tracking site where we're supposed to be able to go back and look at it in terms of zip codes. And I know those last zip codes, East Harlem, Central Harlem, and West Harlem numbers were relatively high,
Mm-hmm.
but still, there's not a lot of testing sites. And vaccines are not readily available again in a lot of these areas. So again, where's the help? Where's the resources? You know,
Mm-hmm.
they're not available. So where do we go from here?
Absolutely. And you are right that we still see high transmission rates in our neighborhoods and in our zip codes. Uh, so I'm looking at 10027 right now. Um, it's the case rate is lower than the Manhattan case rate, but the death rate is still higher than Manhattan's death rate, and the vaccination rate is lower than Manhattan's vaccination rate. So we still have issues here in our community, and but that's also what I mean. There is no variance in terms of looking at what's happening on a neighborhood by neighborhood, zip code by zip code basis. There's no talking about what happens when it goes down, what happens, you know, many people are predicting that by the spring, we may be totally out of this or essentially, you know, materially out of this. How long these protocols stay in place? And I think that there should be a little bit more thought in terms of that, so it doesn't turn into a permanent situation where it doesn't answer all the questions. Because is it just about this particular vaccine, and what happens, when the next virus occurs and it's not COVID-19, it's something else. You know, how do these protocols then um, apply? So there are always some questions that I think need to be answered. There's a lot of burden on the small businesses because for each fine, there's $1,000 um, um, fine per incident, and then it goes up to $2,000, then it goes up to $5,000. So once again, there's a lot of burden on the small businesses that have been up and down, just trying to survive. So it's just things that need to be thought of.
Yeah, it's just such a crazy situation, from day one, seeing how um, the response or took place, or the lack thereof of a response. We would then question it, as we should have. What's going to happen with the next one? You know, and things began to open with no specific stipulations on what should happen. Businesses, of course, they just opened. People just started to pile in anyway. But what happens? We can't even get out of this one. It's fair to say that there's going to be more. It's not if, but it's when. How is that going to be handled? Because even now, as I said, with the lack of the resources that still exist, um, and the opening up, the way things opened up, it was like you rented strawberry fields and let anybody come in, and then after the party was in full swing, you came in and said, "You're not invited. You're not invited. You're not invited. Get out."
Hmm.
I mean, we people were just literally living like this thing had totally either been eradicated, or if as if it never existed.
Hmm.
And once people got that mindset, it's kind of hard to pull people back and start telling them, now we're open, but you can't do this, you can't do this, you can't do that.
Hmm.
If the information about the vaccines had been more forthcoming, if the data was readily available, if more push was being done through social medias, through from the Department of Health, from the people that were in charge, more information had been going into the hesitant areas early on. But no, people were allowed to just fall into a certain mindset, and that's where they are. And so I'm still talking to people. No, I'm absolutely not getting the vaccine. And that's all it is to it. So all of this, you can't go here, you can't go there, you can't do this, you can't do that. That should have been put in place before.
Hmm.
The importance of the vaccine, that should have been put out there before, not waiting for other people to put the stuff out. This is your job. You're in charge. You should have been pushing, pushing, pushing. Even before the vaccines were given, you should have been pushing the necessity so that all the naysayers, so all of the conspiracy theorists couldn't get into the minds of the people and the fear. And it wasn't just Tuskegee, because most of the people I talked to, didn't know anything about the Tuskegee experiment. So they kept creating this narrative, and people got into that mindset where they said, I'm not doing it. But that was on the faults of those in charge.
Hmm. Yeah, we got a comment saying that I think we need to place more emphasis and strongly advocate for more funding to address the health disparities that make us more susceptible. That is certainly a true statement. And that's probably been one of the biggest takeaways from this whole pandemic. Were the reason why it hit our community so hard was because of those health disparities, and unfortunately that's also what created hesitancy in a lot of people, because there's just not in many cases there's not a lot of trust in the so-called system, because the system has not been there to help us in the past, and now people are being asked to trust in the system that didn't wasn't trustworthy before. So those are things that I think people have done their efforts to overcome that. And the other truth is that there is more vaccine hesitancy in the far right white community than there is in the black community, even though we have it. But when we actually saw the numbers, and that's the interesting thing, because you know we actually look at the numbers. A lot of people will take one number out of context but not look at the other. So they'll look at the vaccine hesitancy among black people, but then when you break it out to white male Republicans, you'll see that they're up here, and that's the reason why the southern states right now are just overrun with the Delta variant, because you had people who were um, not taking the vax, also not wearing a mask, and acting like this disease didn't even exist, and that's just been a recipe for disaster.
And I mean, this is states that's going to penalize people for using masks. Like Florida. I mean, really, really, you're going to
Hmm.
withhold the administrators in your educational systems. You're going to withhold their pay if they insist that the children are safe, if they insist that the children are masked. I mean, really,
It's
in places like
unbelievable.
Arizona, the doctors and the nurses, they're coming together and they're just begging for help. Their numbers
Hmm.
are worse than they were during the peak of the pandemic, when all of these refrigerator trucks was being parked outside of hospitals. So many people were dying in a day, in an hour. And the thought that these things are still going on and that there is no national mandate, because personally, for every governor who refuses to put a mandate in place, in particular to protect our children, they should be removed from office.
They
And
should
it's
be
just that,
indicted and sent to jail.
and
I mean,
should never see the light of day.
hmm
I mean, they're saying that the numbers there with the children are rising so high that it's just insane. And you want to hold people, and thankfully, these administrators are saying, yeah, we wish you would. We're opening, we're putting mask mandates in place, and we'll just have to sue the state. But that's what we're going to do to protect our children. And this is nothing but a political game where, this guy is hooked up with Fox News and all these other, you know, crazy Trumpish sites,
Mm-hmm.
trying to get another run, I believe probably as the president. Because we still got to remember 70 million people voted for minus 45. So
Mm-hmm.
there's a lot of people out there who are not thinking, who I'm not sure what's up in here. I'm
Mm-hmm.
not sure what's up in here because we was able to see this catastrophe.
Well, what's really crazy is if you go back to February of 2020, when we first started looking at this thing, and we saw what was going on in Italy, where they maxed out the entire hospital systems to the point where they did not even have enough beds to cover everyone. And then March and April hit here, and we were afraid that that was what going to be the case, and we got close to it. We certainly pushed it to the limit, but we never got to the point where there wasn't a bed. If 911 came to pick you up, they at least had somewhere to come and take you. But now we're a year, almost a year and a half later, and in these southern states like Louisiana, Alabama, Mississippi, they're literally maxing out the ICU beds. And for that to be happening when we already saw the problem and we're in the same country, and it's just unimaginable that we would get into this situation when there was more than enough information to say, steps had to be taken to stop this.
I don't know. It's just for a lot of those states, it's just so out of control. I don't even know how they would reel it back in if they have no true leadership,
Hmm.
you know, and the leadership is not, in concert with the health authorities. It's like this is what I say. I'm going to do it this way, and I really don't care what you think. So that translates into I really don't care if you get sick and you die. I really don't care about these precious innocent babies who are getting sick and piling up these hospitals. I really don't care. And yeah, a lot of these people running these states need to be in jail.
Hmm. But what they do care about is their comfort, because the idea that wearing a mask is some sort of um, terrible burden is just unbelievable.
It's like, are your kids going to school? Are their kids going, or grandkids going to school, or nieces or grandnieces and nephews going to school? Yours first.
Hmm.
If it's not a problem, send yours first.
Yeah. Oh, that's the other thing about these governors in these states is that most of them they're sending their own kids to private school, and then they're telling the public schools that they can't have masks. And those private schools, they're wearing masks. They're doing social distancing. And a lot of those private schools, they have enough resources that they can actually do it effectively. They can have weekly testing, they can do masks, they can do social distancing, they can set up classes outside because they're on big campuses. They can do whatever they want to do. And so once again, it's a case where the politicians are doing for themselves something differently than they're asking other people to do.
And it's interesting. I remember back then when they were first trying to figure out how the kids would go back to school, and I don't know if we showed it on. I don't know if we actually showed it here, but they had these little cubicles. You remember
Hmm.
that they had these little cubicles. Each child had their own cubicle.
Hmm.
And we said, well, that's what may happen in the private schools. That's not going to happen in the public sector.
Definitely not.
So I mean, like you said, there's so many different ways that they could do things. Also, like you said, they have huge campuses. You know, they can split those classes up and send some 50% to the classroom, Some of the other ones are socially distanced in the lunchrooms, even in the cafeterias, and they have enough resources to get desks and chairs and different things to alter the schools in order to accommodate their kids. But the bottom line is, I mean, it's almost like they're saying, hey, if you don't have any money, then you just take your chances because your
Mm-hmm.
kids are going to school, and then we want to penalize you if you don't send your kids into what could be death traps.
Mm-hmm. So, I for all the parents right now who are dealing with this, you know, we hear you. We know you're going through it, and we hope that we can bring you information that helps you sort some of it out.
Yeah, you know, I'm just. I think after all this time, I'm really starting to get weary. It's funny that took a long time, but I just see things reverting, just going
Mm-hmm.
backwards. And we're supposed to be so great. We're supposed to be so much better than that. But
Mm-hmm.
as you can see, everything that was brought forward historically is being turned around. It's
Mm-hmm.
reverting back to what it once was. And now the pandemic is being used as another tool in order to do that
Mm-hmm.
and to continue and reinstitute new ways to segregate people and to make sure that these inequities and inequalities exist. It's just more and more, like they said, if half the people out here who were doing harm could use their brains to do good, my goodness. Well, the same thing applies to those in charge. Shame on all of them.
So, we did not mention the fact that the Pfizer vaccine has now been declared. It's gotten a full authorization, not the emergency use authorization. Um, and there is still a lot of discussion and debate about booster shots. Um, so there are some doctors who are saying, let's see the research on it. Um, and I think that's that seems to be the across the board. Let's look at the science because that's what the narrative is saying in terms of following the science, following the data around um, you know vaccines, around its use, around what are the adverse effects, what are the non-adverse effects, where has it been most effective, and really looking at this data and making long-term decisions based on the data, not just based on the way the political winds are blowing.
Data, that's the main problem. Lack of
Hmm.
data,
Hmm.
lack of sharing data,
Hmm.
lack of um, metrics to hold data, lack of people working together. And this is, if there was ever a time when the right hand needed to know what the left hand was doing, we're living in it.
Hmm.
That's the main problem. Coming from the top, where the other people who are allowed access to the community that's trying to help to, bring this thing under control, that's trying to help to get information and data out into the communities. Those people have worked so hard. These are the people we communicate with. They've worked so hard. But to be under people who refuse to release information, you know, it was just mind boggling. I know we were tired. I know they're tired. But I mean, just the lack of information, and when it came down, it trickled down. And when it came down, it didn't come in complete. I mean, we should be able to get one list of where everything is. And everybody should be able to share those lists. We
Mm-hmm.
should be able to go into a database, pull up certain information, search certain things, and find that information. That was not available. So to be in these meetings and this person is saying, oh, I heard there's a testing site at this place. And oh, it's somebody else. Oh, there's a testing site here. Oh, there's a vaccine site here. That in light of all the people who died from this disease, all the people who are suffering from this disease, the long haulers, you know, I I I still say, as I look at things back to September, I'm almost positive that I had it and I must have had the antibody because I'm just looking at things now. Things that I have been seeing, one or two things I shared with you, the things that I've been seeing, that coughing, I couldn't stop. And now I'm starting to see confusion, some confusion in in different areas. And the thing that really set up was my taste. Like I'm eating, and it was so obvious that all of a sudden my taste buds just disappeared. And I kept trying. I was like, I don't know how I could get them back, but I kept saying, I what happened to my taste buds? And then they will pop back in. And this is still happening. Maybe not a lot, but it just disappears and then it comes back later on, you know. So there's like in the confusion, I'm starting to see a lot of different things that's going on, and so I think being in as a part of it and experiencing these things, and this, as I said, was back in like maybe around September of 2019, you know, that when the testing and everything was really available to our areas, I didn't test for the antibody. But then again, they said the antibodies didn't last that long. So I was still living in confusion, talking with my doctors and everything. So, I mean, this thing is like it's something. But yeah, I'm pretty positive that I had something. Pretty positive.
So, I think we've covered about all that's going on now. Anything else you want to add, Carol?
Um, just I'm just thankful to all those like I said, the people that we work with from New York City Emergency Management, Department of Health, Mental Hygiene, Department of Health, you know, the Harlem Emergency Network, East Harlem COAD, New York North Central, our radio team, communication team, the New York City VOAD, certainly LES Ready, all those people that pulled together and
Mm-hmm.
worked hard and is still working equally hard to to really just keep our community safe. We can't thank you enough for sharing that data with us, for including us in being allowed to sit at the table with you and give you whatever you were given that you could give us. And to know that a lot of the stuff we weren't getting because you didn't have it. You weren't getting it. We saw your frustration as well. Because everybody does not have the heart to work to do this work. But we saw your heart, and we knew that you was trying your best to get us the most pertinent information and up-to-date information that we could possibly get. And your hands were tied. But we still thank you for your efforts and thank you for the continuation of the work that that we'll be doing. That's why we're here. We're going to continue to work. We're going to continue to fight. We're going to continue to dig, and we're going to try to we're going to continue to bring you pertinent information that you can store, you can hold on, you can come back to us, send us messages, You talked about something, we can pull up a website, we can pull up an article that you can see. Whenever there's any confusion, we'll always do our best to give you up to date information. And thank you all. Those who tune in may not say anything, may not type in the chat, but that are part of our viewing audience. There's a reason why you keep coming. So hopefully you will continue to keep coming because we will be here. If it's just Bob and I, we'll be here.
And also to remind you, and this is something we've been saying since day one of our first broadcast. We've done about 70 of these, and we've been telling you to tune your immune. Matter of fact, I want you to see the shirt. It says tune your immune. And the reminder that the vaccine, how it works is that it notifies your body, it identifies the virus, but your immune system is what defends your body against the virus. And so if your immune system is compromised, it doesn't matter if you've had the vaccine. And that's what we've seen. There have been some people who've been immunocompromised and the vaccine is less effective. And so but even if you have had the vaccine, if your immune system is not up to snuff, you're not putting yourself in the best position. So it's time to learn how your body actually works, how your body defends itself, and do those things you need to do. And the simplest things we've told you, get your vitamin D. It's the summer. Vitamin D is cumulative. So now is the time to get as much direct sun as possible and take that into the fall. It'll help your body defend itself. As we've seen, these viruses have been cyclical, and we've seen that summer months they might win, the rates might go down, and then we saw them go back up again when things got cold and people were not outside as much. So get your vitamin D either directly or by supplements. Get some zinc in your system. Eat fresh fruits and vegetables. Take probiotics. Get lots of sleep and reduce stress in your life. And these are the health factors that will help you not only overcome COVID if it comes your way, but a host of other things. So we thank you for listening, and we'll be back again. If not next week, the following week, depending on the news. But we're right now on a bi-weekly schedule. But if the news is important, we will be here regardless. All
Thank
right.
you.